Very nice setup.
Oh, thank you.
Very nice.
This paper over here, it's got to be wrong, but it says you've been a cardiologist for over 30 years. That's too long. That sounds like a world record.
More like 25 years.
25 years. How'd you get started in all this?
My mom died of sudden cardiac death about 4 months after a successful 2-vessel coronary angioplasty. And that's what I did. I did angioplasty, atherectomy, put stents in, stopped heart attacks, all those kinds of things. So my mom died suddenly. I came from New Jersey. She was living in New Jersey. I was in Wisconsin at the time. I get the
How
call.
old was she?
In her early 70s. So she drops dead of the disease I took care of every day. And I thought I knew something about. But it got me started on this idea that, you can't deliver health in a procedure lab, in a cath lab in this case. So I started to look for ways to identify people, months, years, or longer before those kinds of terrible things happen to people. Well, back then, the device we used was called an EBT device, and we did heart scans. We scanned thousands of people. I set up the first scanner in Wisconsin. There was 2 in Chicago, but none in Wisconsin. We set that up and started scanning people left and right. And it became clear heart disease is everywhere. Business guys, 50 years old, says, I just want to know, my dad had a heart attack at age 52. I'm 50. Do I have it? Yes, he does. We scan him. He's got a high score. A normal score is 0. And what do you do about that? So I'm having all these people very concerned because they have coronary risk. They have high heart scan scores. And back then, this is 20-some years ago, my answer was Lipitor, aspirin, exercise, everything in moderation, cut your fat, right? We helped publish the data to show that does not work. It has zero effect.
Why was that your answer?
Because that 25 years ago, 20-some years ago, there wasn't a whole lot more in conventional healthcare.
That's what you were taught.
And that's what yes.
That's what you learned in school and things like that and in your practice.
Right. The consensus opinion, by the way, when it became clear that conventional answers did nothing, the consensus opinion from experts was, don't scan people again. Just let their heart disease progress and wait till they have chest pain or a heart attack, then deal with it.
Wait till the symptoms?
Yes, which of course half the time is death.
Right.
So I thought that was completely ridiculous and unsatisfactory. So I started to set about finding my own answers. And it took some years of stumbling around, but it led to lessons like when you add vitamin D to someone's regimen, the heart scan score plummeted. It dropped. It was the first time I saw dramatic and very consistent reversal of coronary disease. But the other thing that happened was, if you reject this idea that cholesterol testing shows you heart disease risk, which is an absurdity, by the way, it does not. Cholesterol has nothing to do with heart disease. It's a crude marker for the things that cause heart disease, that is lipoproteins in the bloodstream, particles that can cause heart disease. If you track lipoproteins, you see right away that by a long stretch, the overwhelming cause for coronary disease, that is people with these high heart scan scores and risk for heart attack, is not cholesterol. It's not bad cholesterol. It's small LDL particles. And the science is quite clear on this. Not my science, by the way. This came from UC Berkeley and Hopkins and other places. The factors in diet that cause small LDL particles that are very inflammatory, they last longer in the bloodstream, they're very adherent to artery tissue. The only foods that cause an explosion in small LDL particles in the bloodstream, grains and sugars. So I had my patients with these terrible small LDL values, maybe 1,800 or 2,000 or 2,400 nanomoles per liter. I'd have them remove all grains and sugars. They'd come back, we'd remeasure small LDL, it'd be 0 or some other very low number. In other words, it wouldn't be a little bit better. It wouldn't be 20% better or 30% better like you get with a statin drug. You'd see obliteration in the majority of people. But then everybody started coming back and saying things like this. Hey, you didn't tell me I'd lose 57 pounds. You didn't tell me my irritable bowel syndrome, ulcerative colitis, Crohn's disease, seborrhea, psoriasis, eczema, joint pain, migraine headaches, depression would all go away. And at first I thought, well, I didn't know it was going to go away. But this happened so many times, became clear that I had stumbled on something, that if we take the foods that all nutritional authorities, at least at the time, advocated eating, that is whole grains, if we took them out, astounding things happened. And so that led me down the whole wheat belly path.
Yeah, just removing junk. I mean, it tends to be what we want to overeat and overindulge on when you have things like red meat and eggs, and you have almost a lower carb lifestyle. You certainly can overeat on those foods, but you don't really want to. It's not like eating chocolate cake.
That's right. And there's something in wheat, particularly modern wheat. So one of the things that I learned because I wanted to understand, why is this happening? Why are people having dramatic transformations of health by taking out the food all nutritional authorities advocate
Yeah,
eating
what's
more
wrong
of?
with wheat? I mean, haven't we been eating, grains for thousands of years? I mean, haven't people been eating it for a long time?
We've been eating it, give or take, about 10,000 years, meaning less than 1/2 of 1% of human time on this planet. So it's actually a relatively recent addition to the human diet, speaking anthropologically. Now, when we did add it, we added wild strains of wild growing wheat, like einkorn or emmer. And those forms of grains are not harmless, they're just less harmful than modern strains. Agribusiness and geneticists changed modern wheat. So if when I wrote the first Wheat Belly book, I went out to look for wheat fields. I'm thinking to myself, I can't find any. Until you get up close, you realize modern wheat is a high-yield semi-dwarf strain. It's short, it's about 18 inches tall, has a very thick stalk, has very large seeds, a large seed head. And the farmers like it because it increases yield per acre many times higher, as much as 8-fold higher yield per acre. So you can't blame the poor farmers. They have to pay their bills too. But they also changed numerous proteins in modern wheat. One of the things they changed was gliadin. People say gluten, but a better terminology is gliadin. Gliadin was changed, and it amplified its opioid effects. So when you consume the gliadin protein in wheat, also rye and barley, and the zein protein to some degree in corn, humans cannot digest grains because they're seeds of grasses. That's why when you cut your lawn in the summertime, I don't know if you do that in California, but I know in Wisconsin we do, you don't save the clippings to toss on top of a salad with some Roquefort, right?
Right.
But why not? It's green, it's a plant like spinach, right, or kale. Well, humans are incapable of digesting any component of the grasses, including the seeds. We can't eat the roots, we can't eat the stalk, we can't eat the seeds. Well, we can eat it, but we can't digest it. So the gliadin protein in wheat is degraded only partially to pieces or peptides. And these peptides are often 4 to 5 amino acids long, but they're very unique in structure. And they act as opioids. They bind to the opiate receptor of the human brain. But it doesn't make us high. They amplify appetite. So that's why that effect you're talking about, where people who have chocolate cake just can't stop
Right.
because there's an opioid appetite stimulant in it.
Wow.
But the reverse of that is if you recognize that fact and you take it out of your diet, chocolate cake, bread, bagels, pasta, etc., some really incredible things happen. First of all, you go through an opiate withdrawal syndrome. People call it such things as keto flu, Atkins flu. No, it's an opiate withdrawal syndrome from stopping the flow of gliadin-derived opioid peptides.
Oh,
And
interesting. I didn't know that. I always kind of thought it was, and not even I thought it was kind of more the absence of the carbohydrates is what people were suffering from.
that's part of it. And
But
that's
it's
why athletes
right.
have diminished performance for the first
But
6
it's
weeks
almost
or
like
so.
the addiction to the carbohydrates is what they're suffering from. Maybe more so.
Well, it's addiction to the opioids.
Gotcha.
And so it's very much like opioid withdrawal. There's shakiness, nausea, headache, depression. I've actually seen many people rolled up in balls. They're really miserable. So people listening to this and who do this have to know it can be
I
very
can't eat any
unpleasant.
carbs.
But once you're through that, you have this incredible freedom from appetite. That's why a lot of us forget to eat sometimes. We have a breakfast
Yeah.
of 3 eggs and bacon or something for breakfast, and you're not hungry maybe till dinner time. You're free. And of course, that ridiculous advice to eat many small meals every 2 hours, which is very, very bad advice. All that kind of nonsense goes away when you remove gliadin-derived opioid peptides.
Is there anything that's man-made that's worth a shit in terms of eating?
Man-made?
Like I mean, like I guess something like yogurt. Is not like you don't just find yogurt like in its natural form. Like we got to kind of make it, right? Like is there anything that's modernly engineered or even manufactured on a large level that's healthy for us? That's productive for us.
I'd have to think long and hard about that one.
Yeah.
But I will say fermented foods,
Yeah.
fermentation is a kind of form of controlled rotting
Right.
that became, I wouldn't say necessary, but happened naturally because, people didn't have refrigerators until the last few decades. And even before then, there was only seasonal ice. And so how did you preserve food? Well, you could bury it in the dirt. You
Right.
could salt it. And most of the time you let it rot. But fermentation is kind of a form of rotting. It's lactic acid fermentation. And so yogurt actually is kind of a natural product. We could question about the wisdom of consuming dairy product, but I do want to talk about the yogurt we make. That is a very interesting conversation, a little off topic for this, though.
Yeah.
But, there are foods that humans do manufacture. Because, one of the hurdles for the people who follow my lifestyles is that a lot of this becomes inconvenient. You're preparing a lot of your own food. You're not buying cellophane-wrapped microwavable foods. And there is some preparation. But there are some selected products where you can buy manufactured products, and they're okay. Like coconut milk is pretty reasonable.
Right.
But that's made in the factory.
What about things like rice? Like a lot of us, we like to lift, and for a lot of us, we utilize some carbohydrates for fuel. We utilize carbohydrates to stay big, to kind of keep our muscle mass. And so things like rice and potatoes, those are pretty common in the bodybuilding world, in the powerlifting world. Are those things okay for us, or does it depend on the person? Or
Well, rice is a grain also. It's the seed of a grain, the rice plant. But it's at the more benign end of grains because it's 95% carbs. But it's 95% carbs, so
Right.
we got a problem with that.
Right.
There is a protein, though, so that it does share some proteins with wheat, rye, barley, etc., such as wheat germ agglutinin. It sounds like gluten, but it's unrelated. Wheat germ agglutinin is a very toxic compound. It's completely indigestible to humans. So if it goes in the mouth, it comes out in the toilet. But in the course from mouth to toilet, it is highly inflammatory and very destructive to the gastrointestinal tract. It's also very inflammatory if it gains entrance into your bloodstream.
even white rice would have that?
Even white rice does. Then we have this more recent issue also with rice, even beyond wheat germ agglutinin and its amylopectin carbohydrate content, and that is the newly discovered issue of arsenic. That there's a lot of arsenic in rice, so much so that rice milk, for instance, is highly toxic to infants. So that's got to be looked at more closely. It's not been a common cause of acute toxicity, but whether it's a cause for chronic toxicity is now an open question. It probably is. And so you got to be careful when you consume rice because of those reasons. But it is at the more benign end of grains. But it still is a seed of grass.
How do you think some of this started with us getting so unhealthy? Do you think it was some of the movement towards like fat-free foods and things like that? And a lot of the big food companies were trying to create products that were, because there was a movement, there was a big push along years ago for these kind of things like snack wells and things that had reduced fat in them. And so the packaging would say that a product had reduced fat, and then it was fortified with vitamin A and vitamin D or whatever the hell they were trying to sell you on, right? Do you think that was kind of the start of some of the problems here in the United States with people being so heavy and unhealthy?
Yeah, I think there's a whole collection of blunders we could point our finger at. But I think a big part of it was the bad science, misrepresentation, and ambitions of the people who wanted to advocate the low-fat lifestyle, like Ansel Keys. That he's the most infamous one. Where he
Right.
published the 7-country study that was complete nonsense because he concealed the other data that showed that fat consumption has nothing to do with cardiovascular risk. And so that misrepresentations, misinterpretations, very badly constructed studies, to this day, are still used by the American Heart Association. And they actually said this in their recent reiteration of the low-fat, low-saturated fat diet. They said that the studies from the 1950s and 1960s are the basis for the American Heart Association low-fat diet. Now, they did add some of the more recent data that came from the Physicians' Health Study, Nurses' Health Study, which, in my view, are garbage because they're observational. It's the same kind of study that led to Premarin being the most widely prescribed drug for females worldwide for about a decade. That is observational data. You ask somebody, do you take Premarin? No, I don't. Do you take Premarin? Yes, I do. And you watch those people, it makes it look as if women who took Premarin had less breast cancer, uterine cancer, endometrial cancer, and heart disease. until the real studies came out, the HERS and the Women's Health Initiative prospective trials. We don't say, what do you take? We say, you're taking this pill. I don't know what it is. You don't know what it is, but we'll tell you in 5 years after we see who has more heart attacks and strokes, etc.
Right.
Those studies showed that Premarin increased breast cancer, increased endometrial cancer, increased heart disease, and accelerated dementia. But it's a great illustration of how awful and how misleading observational data can be. Yet that's what the American Heart Association, the U.S. Dietary Guidelines for Americans, USA Food Plate, Food Pyramid rely on observational studies, which is like having no data at all. 4 times out of 5, the conclusions drawn by observational studies are proven wrong. But it leads to titillating headlines like red meat causes cancer. Well, that does not cause cancer. It's just a little bit of observational data suggests there's an association that has yet to be proven.
Should we even have things like the American Heart Association? Should so these associations or the government have any role in what we eat? Like, do we need to be protected from ourselves that much?
I think that an odd phenomenon has happened. The Academy of Nutrition and Dietetics, the American Heart Association, American Diabetes Association have gotten so cozy with big pharma, the medical device industry, the hospital industry, that they've changed their message. Why else would Cocoa Puffs and Berry Kicks and Count Chocula have the stamp of approval of the American Heart Association checkmark?
Right.
But it's evidence of just how deeply Coca-Cola is a big supporter of the Academy of Nutrition and Dietetics. And so they say, oh, Coca-Cola is fine in moderation, just exercise an additional 30 minutes every day. So they have become voice boxes for industry. And undoing that's going to be a long, slow process. It may never happen. It started, by the way, in Australia, where their dietetic community is starting to reject industry funding. It's going to take a long time if it ever happens in North America.
Yeah. Yeah, it seems like it's hard to even figure out like what to eat. You start to take out some of these grains. So, like, what are some suggestions that you give people towards what to eat? Because things like saturated fat and cholesterol, dietary cholesterol and saturated fat in our foods, we can't be eating that all day, can we?
Sure you can. So it's become clear that dietary cholesterol has nothing to do with heart disease. And it's also become clear that dietary saturated fat and total fat have nothing to do with heart disease. What does cause heart disease is when you cut cholesterol and fat and you replace those lost calories with carbohydrates like grains, even whole grains. That's where you escalate heart disease, risk for dementia, gastrointestinal cancers, type 2 diabetes. And that's exactly what we've seen, right? The U.S. Dietary Guidelines for Americans that were released in 1984 coincides perfectly with the huge rise in obesity, type 2 diabetes, and, by the way, the silent epidemic of autoimmune diseases, which is everywhere now.
Yeah. In that shift towards the carbohydrates, does that include, like, if you were to, because if you reduced the amount of fat that you were taking in and shifted over to carbohydrates, I would imagine that you would be eating less calories in a sense. Does it include, people that are, trying to manage their diet, or is the shift to carbohydrates kind of more like people that are rolling through a McDonald's and they're getting the, they're getting the carbs and the fat combination together?
I think there's several, we don't want to make diet too hard for people.
Mm-hmm.
When you impose all these rules where you're counting grams of this or calories, it gets frustrating. And for the most part, it's unnecessary. So what I've been advocating, and it's worked on a large scale, is, of course, no grains because of all the health impairing effects. And ironically, of course, the food advocated and agreed upon by all nutritional authorities, but take it all out. Take out all grains and miraculous things happen. That starts the process. Beyond that, reject this idea that dietary fat, cholesterol, etc. has anything to do with heart disease. It does not. That science is quite solid now. So don't restrict your fat. In fact, I tell people use more fat. Buy some lard, just make sure it's not hydrogenated, tallow, more butter, organic preferably, more coconut oil. Never trim the fat off your meat. Buy fatty cuts. Never buy lean meats. Buy full fat meats. Eat more liver. So don't mind the fat. In fact, if anything, add more fat. If there's something that I think we should restrict, it's carbs, because carbs are cheap, they're filler, and they fill so many processed foods. The easy way to do this is just eat real foods. Eat an avocado, eat a piece of steak, eat bacon, eat green vegetables. And you don't have to worry about that. But a lot of people don't want to do that. And so they end up getting overexposed to carbs. And we have 2/3 of Americans who have diabetes, type 2 diabetes or pre-diabetes. So a huge amount of people need to unwind insulin resistance and limiting carbs. So what we do is we limit our net carb intake, that is total carbs minus fiber, to no more than 15 grams net carbs per meal. And that's worked very, very well for just about
So
every person.
that's kind of the guideline is on average per meal less than 15 grams of carbohydrates, and you said minus the fiber.
Minus the fiber, that's right.
Yeah.
Now, you can change that over time as you get better at resensitizing yourself to insulin, as you lose weight, as you restore bowel flora, restore vitamin D, all the things that influence insulin status. And some people can individualize. One of the things we've done with a lot of people is have them buy an inexpensive glucose meter and check a blood sugar just prior to a meal, and then at the peak of blood sugar at 30 to 60 minutes after the start of the meal. Not like the doctor says, check it 2 hours later, because what he's looking for is how well your insulin or drugs are controlling blood sugar. That's not the question here. The question is, how much of a rise in blood sugar is this meal giving you? And something wonderful happens when you allow no change in blood sugar. I call it the no change rule. So if you start at 90, we want it no higher than 90, certainly no higher than 100. If you start with insulin resistance, let's say you're diabetic and you start at 120, you don't want it to go any higher than 120. When you do that, follow this kind of what I call the no change rule, weight loss is accelerated, reversal of fatty liver, type 2 diabetes, high blood pressure, and a lot of other conditions is all accelerated. But you'll see how readily you can provoke that rise in blood sugar from, let's say, 90 to 130. So if you have a bowl of stone ground organic oatmeal, no added sugar, blood sugar will go from 90 to 180 in no time in a non-diabetic. That's how awful grains can be. That's that amylopectin A carbohydrate that's highly and unusually digestible by humans. That's why grains raise blood sugar so high.
That's fascinating. In terms of in terms of some of the things that you talk about in terms of like gut flora, it appears that there's we need some form of carbohydrates, right? So maybe just eating meat all the time. There are a lot of people are talking about the carnivore diet. My brother's a big fan of the carnivore diet. I've done it myself and had success with it, but that might not be the greatest idea as well, right?
Those are great for the short term. So whether we call it a carnivorous diet or a ketogenic diet, you can get great effects out of that. Accelerated weight loss, reversal of type 2 diabetes, reversal of fatty liver. Problem, you change bowel flora dramatically. And over time, that leads to dysbiosis, small intestinal bacterial overgrowth, SIBO, which is a very serious, very common problem, which amplifies potential for inflammation. People get constipated, they get diverticular disease, and down the road can even get colon cancer. But before that happens, other things happen. HDL drops, triglycerides. So people lose a lot of weight and their HDL and triglyceride and blood sugar improves in the beginning. But long term, HDL goes down, triglycerides go back up, blood sugar goes back up, insulin resistance re-expresses itself. In other words, you have distortions of metabolism. Some of that, or a lot of it's mediated via dysbiosis, changes in bowel flora, but there's other reasons also. We know this because we have experience in the Atkins world and kids who follow ketogenic diets for intractable seizures. So kids, we have thousands now in clinical trials, when they go on a ketogenic diet for any length of time, they have less seizures, that's true, and they have an increase in Akkermansia species in their bowel flora. So there's some positive changes, but they stop growing. They have an explosive quantity of kidney stones. Kids aren't supposed to get kidney stones, but they get both oxalate and urate kidney stones. An occasional kid develops a cardiomyopathy, a heart muscle disease and heart failure. There's an occasional sudden cardiac death, and there's very common osteoporosis. So ketosis, Atkins, low carb, all fine. But one, we got to pay attention to prebiotic fibers that come in carbohydrate vehicles. And two, being ketotic is natural and physiologic for the short term. I kind of look at it as like stress. Stress response, jumping out of a plane with a parachute is a normal physiologic response. But what if you're an adrenaline junkie and you want stress all the time, or you have a source of stress like a sick spouse or a child who with autism you have to take care of? Chronic stress is very unhealthy. We know it increases risk for depression, heart disease, dementia, and cancer. So same thing here. Short-term physiologic ketosis, wonderful, a great tool to know about. but it's a short-term tool, just like stress.
What are these prebiotic fibers that you're suggesting? How do we get those?
So they're nothing more than fibers that you can ingest but cannot digest. We don't have the enzymatic machinery to break down prebiotic fibers. So they get to the bacteria that are supposed to be confined to the colon, and they are metabolized to all sorts of good things, metabolites. And the metabolites of prebiotic fibers are the mediators of many of the healthy effects of having healthy bowel flora, such as better dreams, better sleep, more energy, less anxiety, lower triglycerides, lower blood sugar, better insulin responsiveness. And it's becoming clear that feed your bacteria with healthy prebiotic fibers, and they do spectacular things for you.
Like what kind of foods have that? Like what's an example of like a prebiotic fiber?
Well, let me qualify this by saying, because if I tell you and your listeners, they say, well, come, that sounds knuckleheaded. That sounds stupid. Because what we're trying to do is mimic the natural wild situation. So if we were natural wild people living outdoors in our loincloths and spearing animals and that sort of thing, we would go out in the back in the jungle or forest and dig in the dirt for underground tubers and roots and eat them. Or we might cook them, but that's how we got it. Well, no one wants to do that now, right? And where I live, the ground's frozen for several months a year, so we can't do it.
Yep.
So how do we mimic that kind of behavior that we know primitive cultures do? We eat things like a raw white potato in a smoothie, chopped up in a smoothie, a green unripe banana, likewise chopped up in a smoothie, legumes in modest quantities. We try to stick that net carb limitation. So legumes, chickpeas, hummus, jicama, other root vegetables. So these supply the prebiotic fibers that nourish bowel flora that in turn protect you from colon cancer, make you a healthier emotionally person, and have all kinds of other beneficial effects.
Would dairy kind of fall into that category, like the lactose that's in dairy, or not? No, it wouldn't be a prebiotic, you think, or
Not lactose,
oh,
no.
okay.
We do some manipulation with yogurt to get some probiotic effects out of it, but I don't believe there's much in the way of prebiotic fibers in dairy.
Why do you think so many people nowadays are suffering from? I hear so many people talk about depression and anxiety. Obviously, like there's a lot of things going on in society that might be driving that. But do you think it has a lot to do with our food?
I think it does, and the consequences of disordered diet. So, when we were kids, you go out in the field. I had to walk 2 miles to school when I was a kid.
Uphill both ways.
That's right.
I've heard the story.
I'd walk through the field, and there'd be grasshoppers everywhere. So many they'd often hit you, right? And at night in our backyard, there'd be fireflies filling the bag, right? And there'd be butterflies all day long. Well, today, I haven't seen a grasshopper in 40 years. I saw one firefly this summer.
That is depressing.
I think I saw 2 butterflies all summer. So we've screwed up our external environment. We've done the same on our internal environment. And a big component of that, partly a consequence of being told to eat a bad way, is dysbiosis, disruption of bowel flora. Because I see a lot of this reverse when people get their bowel flora back in order, which, by the way, is not the easiest thing to do. And all the rules and practices have not been fully worked out. I won't pretend to have all the answers. But you can take steps to reorder bowel flora and gain back control over health.
You speak a lot differently than doctors that my brother and I have talked to for our movie. A lot of people, some of them aren't cautious. Some of them kind of have their own stance, and they definitely speak their mind. I'm not afraid to speak their mind, but they're not really giving us answers. And I feel like you're giving us answers as if you actually know what the hell it is you're talking about. How do you know this stuff? How do you, like, what gives you the, what do you feel gives you the confidence to speak the way that you're speaking about carbohydrates and wheat and gluten and all these things?
The science is already there. We don't have to invent it. And I can tell you it plays out on a large international scale. So my books have sold in 40 countries, 4 million copies. So I've had a lot of people to talk with, and our social media, people give me feedback all the time, in addition to all the things I did in years past. So I can tell you this works. Hands down it works. With regards to bowel flora, the science needs to unfold. And by the way, that science is progressing very rapidly. But a lot of the practices are not trickling down to people. As you say, a lot of my colleagues are reluctant to talk about it. I'll tell you what we do. I think it's easiest to describe bowel flora as being just like a backyard garden. So if it's April or May, it's going to be a nice summer. How do you have a garden? You prepare the soil, you clean the weeds out, the stones and the twigs, then you plant seeds, and then you water and fertilize it all through the season. So you have nice, big, juicy zucchini and tomatoes. Same thing with bowel flora. You prepare the soil, that is, remove factors that disrupt bowel flora, sugar, grains, don't overdo alcohol, pesticide, herbicide residues in food, etc. GMOs with glyphosate and Bt toxin disrupt bowel flora. So we prepare the soil, remove factors that disrupt bowel flora. Then we plant the seeds. The seeds are currently a multi-species, high-potency probiotic and fermented foods. Kimchi, kombucha, kefirs, yogurts, veggies you ferment on your own. It's very inexpensive, very easy. And then the water and fertilizer for your garden of bowel flora, are the prebiotic fibers. That's what nourishes the plants, the bacteria, and gives you a nice bounty. You won't have cucumbers and zucchini, of course, but you'll have better bowel flora and better metabolic health and better emotional health also.
You mentioned early in the podcast that you did a lot of surgeries. With your stance today and the information that you learned from dealing with many, many patients over the years, do you do the same amount of surgeries?
I closed my practice a few years ago, but I can tell you what happened towards the close of that practice, where I was doing all these things with my patients. And that is, early in my career, for the first 15 years or so, I wanted to do procedures. That's how my colleagues think. I thought that way too. A good day was 10 procedures.
So that was kind of your way of, like, quote unquote, saving people's lives, prolonging their life in a way, right?
Right. Take them to the cath lab, take images of their arteries, put stents in, atherectomy, all those procedures. Well, as I put more and more of my patients on these programs, no wheat, no grains, no sugars, vitamin D restoration, magnesium supplementation, omega-3 fatty acid supplementation from fish oil, thyroid optimization / iodine, and cultivation of bowel flora. What I saw was virtually nobody needed a procedure. Virtually nobody had angina or chest pain. Heart attacks came to a complete grinding halt. The only times I saw any of those things become necessary were the people who didn't give a damn, who said, I'm going to smoke 2 packs of cigarettes no matter what you say, and I'm just going to eat anything I want because I'm 78 years old, and screw you, I'm not going to change my ways. So putting aside those people who don't want to be helped, right? They're happy with their Lipitor and their aspirin, their carvedilol, etc. The people who want to be helped stopped having heart disease. And we also regressed or reversed their heart scan scores.
So I got in conversation with you via text. We went back and forth a little bit, and then you called me, and we were talking about me possibly getting like a calcium score. I believe that's what it's called, right? There's a lot of different tests that you can get done. A while back, I don't know if it was stress. Like I don't ever feel like I'm overstressed, but I don't know. Like being an athlete, you're always pushing yourself, and you ignore everything, you ignore pain, and you just learn to ignore all kinds of stuff. And so I guess I must have been overstressed. I was kind of having this weird sensation on the left side, and I was like, well, I don't want to take any chances with that. That's not smart to ignore that. That could be something serious. And so I went to the doctor and got things checked out, and this was a few years ago, and they'd never really found anything. I had some trouble breathing, but I actually think at that point it might have been something to do with like a lung, or it may have hurt something lifting. And then more recently, fast forward 3-4 years, and these could be unrelated, I don't know. But again, I got pain on the left side. So I'm like, okay, what the heck is this? And this time I was like, you know what? I'm not letting this go this time. I want to actually find out what the heck, is there something really wrong, and is it my heart? And so I went to I just didn't even know where to start, So that was kind of a rabbit hole to try to figure out how to even get into, right? So long story short, I had an EKG, and a resting EKG and a stress EKG done, and everything looked like it was good, and the issue that I had subsided, the symptoms subsided, and everything felt fine. I started working out again, and everything was good to go. So I just kind of wrote it off. I was like, I don't know, like at the time I started running. I started doing some things that I wasn't used to doing. And I was like, maybe it's just that. And maybe it's just the extra stress of like running this business and things like that. And so I tried to quote unquote take it easy and do some things like that. And, it went away. But in getting in conversation with you and trying to figure out, the nutrition side of things and trying to figure out all these things, it was recommended to me to go and get these other tests done. And you were like, you basically told me, hey, no way. I can't even remember the name of the test, but cardio angiogram or something like that. And you were like, absolutely not. I don't think you should get that done. Why were you so aggressive and telling me that may not be a great idea?
Well, the evaluation of chest pain is fairly straightforward in the conventional world, and that's something you have to go through. As you point out, you can't distinguish on your own at home a developing heart attack from esophageal spasm or muscle spasm or stomach ulcer, all the other causes of pain in the chest. So that's one thing, and that the conventional evaluation of chest pain is a pretty good process. Here's the problem, though. You can go through an evaluation of chest pain, be told everything is fine, and have advanced heart disease. Because those tests aren't meant to identify heart disease so much as to identify the cause of chest pain. So what if your heart attack, so let's say this is not from heart disease. Let's say it's from muscle spasm or something. Can you still have advanced heart disease? Yes. Well, how can that be? Didn't they look for heart disease before it generates symptoms? No. And that's why we talked about a heart scan or a coronary calcium score. Though I've been doing that for 25 years, it still remains the best way to evaluate your potential for heart attack and heart disease in the future. And that score goes up 25% per year if you do nothing. And we help publish these data. If, let's say, your score heaven forbid was 500, you have a lot of plaque in your arteries and potential for heart attack. If you take Lipitor, aspirin, beta blocker, cut your fat, exercise, all those conventional things, how fast will that score increase? 25% per year. It has no effect whatsoever. And that data is very clear, by the way. And it's 20 years old. It's been shown repeatedly. Yet that's the regimen the doctor puts you on, a regimen that has virtually no effect. The only effect it may have is a slight quiescence in soft plaque. That's the only effect the statin drugs, et cetera, have. So there's very, very dubious benefits to the whole world of statins and the conventional approach to heart disease. So you want to know if you have early heart disease. And if so, you want to put a stop to it. You never want to allow it to go the path of Tim Russert, for instance, who was told he had a heart scan score of 550 by a heart scan. And his doc said, don't worry about the stupid test. Take your Lipitor, you're pre-diabetic, I want you to exercise every day on your stationary bike. And he died 5 years later on set, on his TV set. If you did the math, his heart scan score at the time of death was about 1,800. And we know that scores over 1,000, the risk of death or heart attack is about 10 to 15% per year. So his doctor was given a crystal ball that said, Mr. Rush will have a heart attack or death probably within 5 years or so. And his doctor chose to give him a regimen that had no effect whatsoever. So that's, I'm advocating. Look, if you want to know about heart disease specifically, look for heart disease,
Right.
but don't accept the ridiculous answers that are being offered in conventional circles. Look for those other answers that can show you, reduce your score, and virtually obliterate your risk for cardiovascular events.
Do you feel that these that there's like that people are giving this advice just purely to make money?
There's such a focus, because I come from that world, right? There's such a focus in medicine and healthcare to generate revenue-producing products and procedures. So this is the great tragedy of modern. So one of the great tragedies in heart disease is that all this focus on such things as cholesterol, which is absurd, on statin drugs, which barely do anything, and silly things like low-fat diets. The biggest tragedy there is not that we're focusing on the wrong things, is we're not focusing on the right things, the things that really cause heart disease, like grain and sugar consumption and provocation of small LDL particles, and what are called postprandial, after eating effects of high carbohydrate diets. Vitamin D deficiency, big effect. Dysbiosis, disruption of bowel flora, big effect. Magnesium deficiency, omega-3 fatty acid deficiency. In other words, there are things you can do that dramatically reduce cardiovascular risk. and even cause regression of coronary atherosclerotic plaque. But it's not on the radar of most conventional physicians.
What does somebody do? Like if they want to like just check and see if they're healthy, just, so they can know, they have knowledge before they have symptoms. Would the calcium score be the first place you would start?
Yeah, that remains the best test. Now, you have to ignore a lot of my colleagues who say it's stupid. What they're trying to say is it doesn't reflect a need for a stent or a bypass operation. But that's not the question, right? The
Yeah,
question
my
is,
wife called and asked that I get a calcium score done. And they were like, okay, well, he can get that test done. And then also we'd like to do an MRI. And then they mentioned some other thing, just exactly as you laid out for us when you called us on the phone.
they smell money. They smell a nice guy with healthcare insurance. They can jack up his costs because a heart scan you can get for about $100, $150, something like that.
Right.
What they hope, years ago when I tried to lobby all the hospitals where I live to buy a heart scan device, when I told them we're doing this for preventive purposes, they all said, we're not interested. We're interested in the downstream revenues. If you can bring in 200 more people, 300 more people who need bypass every year, now we're interested. So in other words, this is the tragedy of healthcare. Physicians, healthcare administrators, big pharma, everybody in healthcare virtually have lost sight of the fact that healthcare is supposed to be about restoring health, not generating lots more money for healthcare insiders. But this is why we have a $3 trillion a year industry and one of the most unhealthy populations on this planet, the most obese type 2 diabetic and inflamed population to ever walk this planet, costing $10,000 per person per year, including infants and small children, and increasing every year. That's the mess we have because of the neglect of the fact no one's paying, except for people like you and me and your listeners who are actually interested in health, not in healthcare revenues.
How much vitamin D would be? Obviously, it would depend on the person. But what have you seen? Like how much vitamin D is an effective dose to help somebody with their issues?
Average need to be in the range of 5,000 to 6,000 units per day in an oil-based gel cup. And I say that because people take tablets, which don't really work very well at all. They're very erratically absorbed or not absorbed at all. People say, but I get sun. Well, sun only works for young people because we gradually lose the capacity to activate vitamin D in the skin as we age, much worse after age 40. So you could have a dark brown tan at age 70 and still be miserably deficient. There's also great variation, though. So not one size fits all. It's size dependent for some reason.
What about just drinking milk?
You'll get a lot of ergocalciferol, the synthetic form of D. Not a good way to get it. It's a low dose. You'd have to drink a huge amount to get the doses we're talking about. And it's usually the ergocalciferol. And what we're talking about is cholecalciferol. So think of vitamin D as a hormone. And we know from many other experiences that human hormones for humans is best. So if I give horse estrogens to a human female, bad things happen, right?
Right.
Same thing here. So human hormone vitamin D for humans, which is the cholecalciferol or D3 form. Now, bigger people who start overweight, need more because fat oddly sequesters vitamin D. So you may have to use a higher dose, maybe more like 10,000, 12,000, 15,000. Best guided by blood work, by tracking blood levels of 25-hydroxy vitamin D. And that person who's heavy, who does this program, loses weight, may even have to reduce D long term. So there can be a moving target on vitamin D.
And you mentioned magnesium. Where would we start with magnesium? I've heard some people kind of say sometimes magnesium cannot be digested all that well or can cause stomach disruption and stuff like that.
Yeah, exactly right, because we're supposed to get magnesium by drinking from the stream or river. But of course, we can't do that now, right? There's pesticide, herbicide runoff, farm runoff, sewage, etc. But if we did, we would get a mixed forms of magnesium and we'd have it for a lifetime. So unfortunately, we drink filtered water. Maybe you filter it in your home or the city filters it, removes all magnesium, virtually all magnesium. So that's one of the problems. I say that because everything that works big time in life serves an intrinsic human need that humans have adapted to and is coded into their genetics. So one of our needs is magnesium, and it's not being met because we filter our water, and modern produce is lacking in magnesium because of modern farming techniques. And so, and prior grain consumption also caused you to poop out almost all the magnesium that was in your diet. That's from the phytates.
That's what's happened to you, Andrew.
Every time.
This guy poops nonstop. He's got like a Guinness Book of World Record.
Yeah, we were
Yeah.
just joking right before we went on. Actually, Daniel pointed it out. He's like, so you intake 1 gram of food, but your outtake is 2 grams. And I'm like, yeah, my
This sounds like a whole new conversation.
my outtake is double my intake.
Yeah,
and I
talk
think
about a
that's-
wheat belly.
Yeah, that's why I'm struggling to keep weight on.
You can't keep it down.
Yeah. Well, I can't keep it in. I can get it down. It just doesn't stop. It just keeps going, and it just falls right out.
Going on forever and ever. What types of magnesium would somebody take, and then where do we get it from?
The best magnesium beyond that you get from food, like nuts and seeds, is the one you make. So I have a recipe called magnesium water, and it's a reaction between unflavored milk of magnesia, which is magnesium hydroxide, and carbonic acid in carbonated water. So the recipe's in my Wheat Belly blog, Undoctored blog, Undoctored book, Wheat Belly Total Health, Wheat Belly 10 Day Detox. I try to make it as available as possible. But you make this, pardon me, magnesium water, and it yields, so the reaction is magnesium hydroxide and carbonic acid, and it yields magnesium bicarbonate.
You're not going to explode?
No. And it's the most highly absorbed form of magnesium. I used to use this to get people off intravenous injections of magnesium, and it worked. Because, there are people who have very serious magnesium deficiencies that are life-threatening, and they have to get intravenous injections every week or so. I got those people off their intravenous needs by transitioning them to this magnesium water. You can't do that with any tablet, by the way. But if you don't like making it yourself, and by the way, that's all described, how to dose it, how to amp up your dose little by little so you don't get diarrhea. Because magnesium is a great laxative, too. The best form is probably magnesium malate, because it's highly absorbable. Magnesium citrate's a pretty good form, but it has more of a laxative property. But some people like that laxative property. So that's a form you can use. There's several other forms. But the key is to pay attention to magnesium. And don't, if you're tracking like your RBC magnesium level, unless you're using magnesium water, it takes 2 years of consistent dosing to even get your RBC level up. But it reflects the profound deficiency we all start with, including in repositories of magnesium like your bones.
What about sleep? Sleep's got to have a huge impact on our heart, right? We need to get proper amount of rest.
Absolutely. That's becoming clearer and clearer. The evidence is sloppy, but it suggests that sleep deprivation leads to increased potential for dementia, heart disease, type 2 diabetes, a lot of them cortisol-driven. So one of the consequences of sleep deprivation is heightened cortisol, and that can lead to a lot of those problems. So yeah, sleep is becoming a very, very important issue. By the way, this crazy yogurt I keep on harping on,
Yeah, tell us about that. What's going on with this yogurt?
One of the effects is profound sleep. Not everybody gets it. So I was thinking about the hormone oxytocin. I don't remember why.
So was I. It's so weird. I couldn't sleep last night because of it. It's like, man, I wonder about that oxytocin.
I'll tell you. I'll cut to the chase. What happens, what we're trying to do with the yogurt has nothing to do with yogurt. It's a means of amplifying bacterial counts. And it's a very specific strains of Lactobacillus reuteri. And strain specificity is very important. It has to be these strains. Because we know these 2 strains work. We don't know the other strains yield these effects. But we make yogurt with these 2 strains. By the way, this is all in my Wheat Belly blog, Undoctored blog. It's called Making L. reuteri Yogurt. So you make yogurt with these 2 strains, and we make it in the presence of prebiotic fibers to amplify bacterial counts. We also ferment for an extended period of 36 hours so that we get very high bacterial counts, and the fermentation exhausts all the lactose, converts to lactic acid. The more lactic acid you have, the lower the pH, more acidic the pH, and it denatures the casein beta A1. So we haven't removed all the problems with dairy, but we've minimized them. But you make this yogurt, and by the way, it's the most thick, rich, delicious yogurt you've ever had. We eat a half cup a day, and unbelievable things happen. Ladies lose their wrinkles starting within 4 weeks, quite dramatically. That's because dermal collagen increases exponentially.
People want to know where to order this. How can I get it on Amazon?
Skin thickness increases because we lose skin thickness as we age. If you have a wound, healing time is cut by half. Muscle increases. You'll see, so in the gym, you'll notice your strength increases and you grow several pounds of muscle. The guys do. Visceral fat is lost. It accelerates reversing insulin resistance. Some people struggle to lose weight because they have leptin resistance. The oxytocin from this yogurt circumvents leptin resistance. Some people regrow hair.
Wow.
It's not quite clear how consistent this effect is, but many men experience a rise in testosterone, which can be quite dramatic. And there's an increase in libido. Daytime energy increases. The effect that I get, one of the effects I get, is profound childlike sleep. I've struggled with sleep for decades, ruined by stress, practice, training, all those kinds of things where you're up all night and, getting called back into the hospital. So even though I stopped doing that, it left me very sleep disrupted. The yogurt is the first time I can sleep all the way through 10 hours sometimes.
Wow.
And sleep like a kid.
What is oxytocin?
It's a hormone that was dismissed for many years as being nothing more than the hormone to cause uterine contraction at birth. That's why if your wife is pregnant, she wants to deliver on October 23rd, Monday morning, 8 a.m., she comes into the hospital, she gets an injection of Pitocin or Oxytocin and induces uterine contraction, cervical relaxation. But it's become clear that Oxytocin is far more than that. One of the clearest illustrations came from an animal study from MIT. It was a rat study, and rats were given a crappy diet, like a fast food diet. Control animals given a crappy diet got old, got fat, got diabetic, lost their hair, stopped playing with each other, stopped mating with each other. Old and fat, right? Other group of mice given the same crappy diet, but also Lactobacillus rhodori, stayed slender their entire lives, thick, rich fur, non-diabetic, played with each other, mated with each other. They stayed young until death. And I think that's kind of what we're seeing play out now in humans who've been doing this. We see them reversing age effects. They're stronger. They're more vigorous. They look younger. So the basic program I've seen, because people reverse inflammation, it's not uncommon for someone to look 10 or 20 years younger. Add this Lactobacillus rhodori yogurt, this crazy effect, and it goes even farther. I've had people who were 65 look like they're 30. No joke. It doesn't happen to everybody. It varies. And this is just in the first 6 months of doing this. So most people who are doing this, following my audio, my conversations, have only been doing it for a month, 2 or 3. Yet we're seeing these very visible effects because they're giving us all their before and after photos. So people with senile purpura, some older people get that, those purple blotches, goes away. We had a woman who was getting radiation to her chest and passed, and had her veins all very visible on her chest. She was very conscious of that. They disappeared within 4 weeks because her skin got thicker. And very commonly we see ladies are more attentive to skin health than guys are, but they'll come back and show us the wrinkles around the eyes are gone, the depth of wrinkles in the cheeks are gone, and they look literally 10, 20 years younger.
What do you think's causing that? You think it's just the oxytocin, or do you think it's a combination of, maybe other things they're getting from the yogurt?
It's confident it's the oxytocin, because if you give animal or human an oxytocin blocker, all those benefits are blocked. There's also some really cool probiotic effects of the Lactobacillus rhodori. So it's not just the oxytocin. There are other means by which
this is not like a standard yogurt that you mentioned you make it yourself, right? This is not a standard yogurt that you buy at Costco or something like that.
No. So those are, if they're fermented, will be fermented by other bacteria. So we have to be very, very attentive to not just species but also strain. So my favorite example is, we all have E. coli in our colons. What if you're exposed to lettuce from the Central Valley of California contaminated by cow manure and has the pathogenic form of E. coli? Well, you can die from that. It's the same species, E. coli, different strains. So we got to pay close attention. Sadly, most commercial probiotics don't even specify the strains, which is a big mistake. But in this case, we only know that 2 of the 200 strains of Lactobacillus rhodori have this effect.
Are probiotics effective, like standard ones that you can just get, for supplements, or standard ones that you get in just like regular yogurt, commercial yogurt?
Yeah, the rules in probiotics have not been all fully sorted out, which species, which strains, which numbers. But I think the conversation is heading towards several basic rules. There have to be sufficient counts. We have trillions of bacteria, so taking a few 100 million is not going to do very much. So you're better off with probably tens of billions or more. 2, one consistent marker for health has been species diversity. The healthier the person, the more diverse the greater the number of species. The more unhealthy the person, the more constricted, limited number of species and proliferation of unhealthy species like Campylobacter or E. coli. Beyond that, we don't have a whole lot of great wisdom. We know that probiotics are helpful in certain situations, like Clostridium difficile enterocolitis. That's common after an antibiotic. It's clear that probiotics are helpful. If you have H. pylori, the organism that causes stomach ulcers, duodenal ulcers, taking a probiotic provides benefit. So we have selected instances like that. What we don't have is here's the best probiotic you can take because it has the best species that yield the greatest benefits in sufficient counts. We don't have that.
Did you learn a lot about nutrition in school?
Hell no. No, you have to do it on your own.
Yeah.
So most of the nutrition now,
Even a cardiologist.
my medical school training that was before cardiology training was really just more biochemistry. It was more about the biochemical pathways and those sorts of things. But a real down and dirty kind of discussion of diet is virtually non-existent. It's changing a little bit, but it hasn't changed that much. And even the young docs, the newly trained ones, are still pretty profoundly ignorant on topics. And I think you and I would agree, the reverse should be true. That should have been number one.
Yeah.
At the top. They should be absolute experts at all issues in nutrition and then talk about taking out your gallbladder or whatever.
Right. Yeah, that's a really fascinating thing because it appears to me from just years of experience, years of being in the gym, it's just hard for me not to believe that everything has to do with exercise and nutrition. I kind of just throw my hands up sometimes. I'm like, all this new evidence will come out that this particular diet helped cure this particular thing, and I'm like, I don't need studies for that. I know. I feel like I've known that for 20 years.
That's great. It's one of the reasons why I wrote the Undoctored book, is because I saw people like you and the people who work around you taking control over health and having magnificent success despite the blundering of my colleagues. So that's why I call it Undoctored. Maybe some enemies, but that's okay. Because I think if the doctor's not helping you get healthy, handing you a prescription for Lipitor or scheduling your colonoscopy or your mammogram or giving you a thiazide diuretic for blood pressure, that's not health. That's just patching things together with a drug or procedure. So real messages in health have to come through podcasts like yours, social media. Even big media has abdicated its responsibility because direct-to-consumer drug ads dominate advertising revenue so much now that anyone with a message that's potentially antagonistic to big pharma is no longer welcome on big media and print media. So what you're doing is so critically important now because people are not going to hear about the deep, deep systemic problems in healthcare.
We like to lift heavy. We like to throw around some heavy weight here at my gym. What kind of impact does that have on the heart? When you're trying to push these heavy weights, is this is it a healthy endeavor? Is it does your body kind of get used to it over a period of time? I mean, we got guys and girls in here. We had a girl yesterday, deadlift Jessica, who you met earlier. She deadlifted 410 pounds for 2 reps. We had a guy yesterday squat 805 pounds for 2 reps. We got some people lifting some crazy weights in here. What kind of impact does that have on the heart?
You can get hypertension. If you ever take blood pressure during those efforts, blood pressure does go up. It's usually not a problem, though. Only occasionally
Goes up
is it a
and
problem.
Comes back down.
Yeah, but it can induce changes long-term that are non-reversible. So I bet for that reason, I'm more of an advocate of high repetitions, lower weights, which is also an aerobic workout.
Right.
And you get less of that kind of static rise in blood pressure that sometimes can lead to issues.
What about things like running sprints or doing things where the heart rate gets to be excessively high for a period of time versus kind of doing more like you're suggesting, something that's a little bit more steady? What's the impact does that have? Is there something that we can do? I guess my main question is there something that we can do to make the heart healthier? So there's a type of exercise that we can do to make the heart healthier.
Your audience may be more serious exercises than the ones I usually talk to, but I'll tell you, just for mainstream America, the most important thing in exercise is that you do something fun. and something you enjoy and something you want to come back
And
to.
that's so you can repeat it, right?
So you jump out of bed on Wednesday morning and say, hooray, today's Wednesday, I get to Samba or whatever.
Yeah.
In other words, for mainstream people,
I agree.
just getting to do something that's engaging and fun, that's the key. And then we have secondary goals. How high should your heart rate be? Should it involve an aerobic burst? Should we do high intensity intervals? All that kind of stuff becomes a little more secondary, but I think there's benefit to all those things.
Right. Yeah.
But as you and I would agree on this, that strength training should be a very critical component of everybody's exercise routine.
Yeah, I've always thought that, I used to kind of be, of the belief like, you can kind of do what you like to do. But now I fully realize that everyone needs to specifically have some sort of resistance training because you need the muscle mass. You just need
Absolutely.
it. I mean, not everyone has to be like huge or anything, but you do need some muscle mass. You need that to help with your blood sugar and just, there's so many benefits to it.
Absolutely. In fact, I would say that muscle mass is a marker of youthfulness. It's a biomarker of health and youthfulness. And as you know, as we age, we lose about 35-40% of muscle mass. And if you yo-yo dieted, as much as 50% of your muscle mass. In other words, we have far less strength, agility, flexibility, and degradation of such things as insulin sensitivity and growth hormone when we lose muscle mass. So returning to more youthful muscle is a really healthy practice and protects you from falls, protects you from osteoporosis, protects you from injury should you fall.
As you were going through, being a doctor and having this practice, and you spend all these years on education and everything, and you're learning more, but then you're starting to kind of uncover that maybe the whole story is something different than you thought. Was there a period of time where you were kind of frustrated and pissed off? Like, man, I kind of thought I was signing up for one thing, and it doesn't really turn out to be what I wanted it to be.
It happened many times over many years. I grew up as a poor kid, and I put myself through 17 years of education and training to find out that what I did was corrupt, that it didn't yield health, that it was aimed mainly to generate revenues, and hospitals would encourage you to do that, by the way. So hospitals love heart procedures because they drive about 50% of all hospital revenues. So you don't hear it this way, but you hear it behind closed doors. They want more heart attacks. They want more heart failure. They want more bypass operations. They want more cardiac cath procedures. To me, this is like saying the campaign in Afghanistan is a huge success, 10,000 Americans dead.
Right.
That's not a measure of success, right? That'd be a horrible tragedy. But you'll hear hospitals and my colleagues say things like, we only did 1,800 bypass operations last year. We need to increase it, and we're shooting for an 18% increase.
Wow.
That's not health, right? That's failure of prevention for a very preventable disease. But it's also emblematic of the kind of thinking that goes into healthcare nowadays. And that's why I say the doctor is not your friend. Sadly, often the doctor is your enemy. But it's so important for your listeners and people interested in real and genuine health to pay attention to these kinds of conversations because they're not going to get it from the doctor.
How important is it for you to practice what you preach?
I think it's pretty damn important.
Yeah.
Yeah. So I try to do all these things also.
Right, to get people to, you're giving this advice and you're telling people, this is the way, this is what I've seen, this is how it works. And yeah, I'm a huge believer that if you're not doing it, you don't have a leg to stand on, right?
I left my Marlboros in the other room.
Is it hard for you? You've been doing, I'm sure you've been following your own diet for a long period of time. Do you deviate from it at all? Do you have a piece of cake? Do you have a donut here and there?
This is true for most people who are grain-free specifically. If they have a re-exposure, whether it's intentional or inadvertent, you have a bad reaction. Most common is diarrhea, bloating, gas, joint pain, skin rash, depression, suicidal thoughts, a return of whatever problem that went away. If you were relieved from migraine headaches or plantar fasciitis or joint pain or seborrhea or psoriasis or eczema or rheumatoid arthritis, it can come back. And especially autoimmune conditions like rheumatoid arthritis, if they come back, they last for months.
You can come back even just from like one
One sandwich, one bagel. Oh, absolutely. Yeah.
Wow.
So
So then
reexposures.
you're just like, you know what? Screw it, man. It's not worth it. Right? If that comes back to you, right, like that, then you're probably like, I'm not doing that again, right?
That's exactly what happens. So, in a lot of ways, people stay on this program for a long period because they know if they have an exposure, they'll get quite sick.
Mm.
There's also an effect I call tongue in cheek. I call it, I ate one cookie and gained 30 pounds. You, of course, don't gain 30 pounds from one cookie. But what happens is people do this. They're doing great on the lifestyle.
That
They're
one
grain
cookie.
free, and they're at an office party and they're serving hors d'oeuvres or it's a cookie or something, Girl Scout cookie, whatever. And they say, I'll have one. I'll be better tomorrow. I'll exercise extra 30 minutes, whatever. But once they get re-exposed to the gliadin-derived opioid peptides, they can't turn it off. And I've seen this happen after people gain 20, 30 pounds in a month, 50 pounds in 3 months. I mean, it's a real effect. And they finally get a hold of themselves, but it's very difficult to turn off once you reignite that process.
What are your thoughts about, a lot of products have been made because, people have learned about gluten. And so then they started kind of making, gluten-free products. They make this gluten-free, the gluten-free, for example, even like Fruity Pebbles that says gluten-free on it. What are your thoughts on the gluten-free movement? And are these things, are they beneficial to us? Are they healthy?
They're absolute garbage because they're made with cornstarch, rice flour, tapioca starch, or potato flour. So very few foods
So
raise.
replacing one thing of junk with another.
Yes. So very few foods raise blood sugar higher than wheat products, like whole wheat bread. There's a very short list of foods that raise blood sugar even higher. That would be cornstarch, rice flour, potato starch, tapioca starch. In other words, the gluten-free foods are extravagantly effective at sending blood sugar sky high, causing insulin resistance, causing visceral fat, inflammatory fat growth, causing weight gain,
Yeah.
adding to risk for dementia, heart disease, cancer. In other words, they're horrible. Yet people think they're good because they don't have gluten in them. So that's a very, very bad way to think. You can be gluten-free, just don't rely on gluten-free processed foods made with those 4 primary ingredients.
Yeah, I mean, it'd be tricky, like you learn that you have a gluten intolerance, and then you're like, okay, well, that kind of fits into my diet because it says it doesn't have gluten in it. So you're thinking like that you're doing something good for yourself. You think you're kind of buying into this diet by getting some of these snacks, and you're thinking, oh, I'm going to make things more convenient for myself. But really, you're just still adding to the problem, right?
Exactly right. The grain industry is in a lot of ways, a lot like the tobacco industry. So when I went against the grain industry, they hired PR agencies to go on the attack against me. But they backed down when they realized they're also the gluten-free industry. And they could hire PR people to write articles about how gluten-free is wonderful and then sell gluten-free foods. So just like tobacco, they're very good at muddying the waters and kind of confusing people. That's part of the reason why there's so many people who think, oh, I did wheat belly, and I went gluten-free, I gained 30 pounds. It doesn't work. Well, they didn't pay attention, right? You can be gluten-free, just don't eat gluten-free processed foods.
Are there some people that attack you in a way where they'll say, oh, he's, talking about, how the medical community makes all this money, but then he's selling all these books? Kind of people saying stuff like that?
You got to get your message out somehow.
Right.
I suppose I got to wear a placard and stand in front of Best Buy, but that wouldn't work too well.
Right. Anyway, Andrew, you got a couple questions to shoot at him here? I'm sure you got full of them over there.
Yeah, actually, and I'll just start off with like a super personal one. If you can use your imagination, I'm 33 years old right now, but let's pretend I'm double my age. I'm 4 years removed from triple heart bypass surgery. What I'm getting at is I'm pretending I'm my dad right now. He's still currently taking 80 milligrams of atorvastatin and 325 milligrams of aspirin daily. Can you consult me on what the dangers of that and what I should be doing right now?
Sure, Andrew. So like we said before, the great tragedy, what's happening to your dad, is no one paid attention to the real causes. They're paying attention to these trivial causes,
Yeah.
like high cholesterol, the atorvastatin, which is Lipitor.
Mm-hmm.
So we know if we were tracking your dad's heart scan score as a reflection of how much atherosclerotic plaque he has, we know it have no effect at all, zero effect.
Mm-hmm.
So what they're doing is virtually nothing. The aspirin does reduce heart attack risk a little bit at a price, though. It's not a good thing for you. But that's all they've done. So all your dad has done, essentially, is take a drug that prevents blood clotting slightly, aspirin, and atorvastatin, which has a very teensy-weensy effect on subduing the rupture of soft plaque. That's all he's doing. But what about all the other causes that are not being addressed? The excess of small oxidation-prone LDL particles, the postprandial after-meal distortions of lipoproteins, lack of fish oil, omega-3 fatty acids, lack of vitamin D, thyroid problems, dysbiosis. And that's just the basic list. There's more things you can do. So in other words, my colleagues pay attention. They do the most minimal things. So what his doctor has done is essentially nothing, and said, just go with the wind. We'll see what happens to you. When you develop symptoms or have a heart attack, then we'll take care of it with the real solution, which is a bypass or numerous stents or something like that. The truth of it is, Andrew, is heart disease is easy to identify and easy to stop or reverse. But you can't do it with Lipitor. You can't do it with aspirin.
Yeah, because they had said he just naturally developed a lot of cholesterol, and that's what was blocking everything. So at that time, they said the only way to fix this is they had tried the stents, but it did nothing because I guess they were so clogged, and so they did triple heart bypass, and he's been on these statins. And doing this podcast, I'm learning so much about everything, and like, oh wait, shit, Dad, what are you taking again? Like, I just text my mom. I'm like, hey, can you tell me exactly what he's taking? And he's still taking these statins, and so I'm like, I need somebody with a lot more knowledge than just listening to people to tell him what he should be doing. And so if he were to stop taking them, would anything happen, like bad?
Well, with stents, President Andrew changes this picture. He needs to be on aspirin because he has stents now. So it's a very artificial situation.
They were just going to attempt the stents, and it didn't work.
Oh,
so
got it.
They're no longer present.
At this point...
Correct. They did a bypass.
Okay. Because he has bypass grafts, he needs to take the aspirin. So it's an unnatural situation, right? You and I should not take aspirin. Aspirin does nothing in the vast majority of us.
Right.
But in your dad's situation where he has vein grafts, he needs to take the aspirin.
Okay.
But it should become as no surprise that his disease has progressed because nothing has been done to stop it. So if the rust on your rear fender started and all you did was look at it,
right.
it's going to get worse, right?
Yeah.
Same thing here. If nothing was done to stop the progression of the disease will progress.
Okay.
So all the things I'm talking about that I might call the undoctored program or the Wheat Belly Total Health program, this all came from efforts to reverse coronary disease. Now, the problem with your guy like your dad is he's starting so far into the process.
Yeah.
So he would have to do this with absolute meticulous attention to all detail and probably add on some things like intermittent fasting, which is a very powerful tool for controlling heart disease and even reversing symptoms. He may want to do
why is that?
Not clear exactly why, but probably because you're more rapidly restoring insulin sensitivity, including that driven by fatty liver and liver insulin resistance. So the mechanism isn't entirely clear. It's also a very rapid way to reverse something called endothelial dysfunction, which means the artery's abnormal potential to constrict. Intermittent fasting. Well, so the basic program, just getting the basic program is spectacularly effective. Meaning, no wheat, no grains, no sugars, right? Net carb limitation. Fish oil at a therapeutic dose, which I would define as 3,600 milligrams EPA DHA per day. Vitamin D restoration to a 25 hydroxy vitamin D level of 60 to 70 nanograms per milliliter. Magnesium supplementation, preferably magnesium water, much more rapid, much more effective. Iodine supplementation, and thyroid optimization. Because thyroid dysfunction is rampant for a variety of reasons. About 35% of Americans now have thyroid dysfunction, and that acts as a cardiovascular risk factor. It can accelerate growth of plaque. And then lastly, all the efforts we take to cultivate healthy bowel flora. A high-potency multi-species probiotic, enthusiastic consumption of fermented foods, and prebiotic fibers, 20 grams per day. So That's kind of the starting program.
Yeah.
And you can add things on. The oxytocin boosting effect of the yogurt,
Right.
huge effect. It'll help him intermittently fast. MCT oils that help him, he can put in his coffee. I use MCT oil powder with a little collagen hydrolysates and makes a beautiful, delicious coffee creamer, tastier than cream, by the way.
Nice.
Add a few drops of stevia, and that will help turn off his appetite. It'll assist him in intermittently fasting. So that's kind of a landscape of things he could do. But as you can see, there are people who say, screw it, I'm going to take Lipitor.
Right.
So we have to have people engaged. It would be a lot nicer doing this 20 years ago,
Yeah.
but it means, a guy like you can start now.
Yeah, right. And, I don't know if it's a hereditary thing or something I'm going to have to think about, pretty soon here and whatnot. But the issue is, the miseducation that, like I said, I think he's 66. I'm probably off on that. But he's had, a lifetime of doctors telling him what he should do and should not do. And then right now they're just grilling him. No, you need to take these things. You need to follow this protocol or else it's going to get worse.
Are you starting to appreciate the enormity of the blundering that goes on in healthcare?
Yeah.
We give you a diet, low fat, low saturated fat, healthy whole grains,
Yeah.
that causes diabetes, insulin resistance, and heart disease. And then we come to your rescue with drugs that barely do anything and procedures. Do you see? It's the mechanic telling you, Andrew, don't bother changing the oil in your car. You don't really need to do that.
Yeah.
Just come to me at 50,000 miles when your engine seizes, and we'll put in a new engine.
Right. That's a great analogy because that's exactly what it's. Yeah.
They've created the market.
Yeah, and then when I'm sitting there yelling at them, and because they're using fake butter or whatever, I'm just like, no, like use this real stuff, and this is actually good for you. Like have fat, it's okay.
Yeah.
Oh no, we can't do that.
It can become problematic though. If people are mixing messages, that could also be dangerous. If you are like the doctor is giving you these Band-Aids because you have some cuts. It's not fixing, it's not healing anything, but they're giving you these Band-Aids to just, kind of cover up these cuts that you have. And I think that a lot of times what happens is people start to get mixed messages and they're not sure like if I go increase the fat, but I'm not making these other changes to my diet, like increasing your fat, but still leaving the wheat and the other things in there. Well, now we're
Right, yeah.
now we're causing even a bigger problem. So it's like you got to kind of pick and choose. What are you going to follow, and then you got to really try to stick to that regimen. But it's amazing to me, and it's really frustrating to see that we end up in this position because it can sound complicated. You can rattle off all kinds of different names of different saccharides and different things but it's really just, it's just eat healthy, which has been a very normal thing for a long time. I realize the grains are problematic, but people have been talking about meat, vegetables, and fruits for forever, and people have been eating them forever and have been having success with them forever. So it's mind-boggling. But then you get in this position where you're sick, your heart hurts, or you're in pain, you have a heart attack, and you go to the doctor, and you're in no position at that point to feel great about the assumptions you may have towards nutrition, and you're relying on this guy to pull you through, and you're like, okay, I'm gonna give you my life, and I need your help, and you give me the advice or give me the drugs. And now I should be off, and I'm back with my family hanging out.
Well, this is why efforts like your podcast are so critically important. It's a chance for people to hear these ideas, talk about them, share them with other people, think about it, because it's not coming from the doctor. The doctor will hand you a prescription for Lipitor and a thiazide diuretic is not giving you health. So if they're not doing their job, that's what we're trying to do. And granted, not all the answers are worked out.
Yeah.
I can tell you, I think if your listeners don't come away with anything else but this, people have enormous power over their health. But it won't come from the silly attitudes and beliefs of your doctor. It's got to come from what you're doing, what others are doing. But it's a great reflection of the power of crowd wisdom that we put our heads together and answer these questions. And you know what? The answers are coming. I was a type 2 diabetic 25 years ago. I'm not anymore. I've helped countless type 2 diabetics become non-diabetic. It's easy as hell. It's easy to reverse heart disease. It's easy. But
It would also be easy for you to be a type 2 diabetic again, right?
It would be.
Yeah, like it would take, it probably just take a few months.
Or even a few weeks.
Right.
Yeah.
Right. But in Andrew's case of his dad, if let's say he was to follow everything, I mean, I know everybody's different, but if he was to follow everything to a T, I think he would see drastic results very quickly, right?
If he could commit the resources and the
Yeah.
if he does it, that's the key. But I've seen people do it. But you have to really stick to the program at this point in his life where he's been down the bypass, failed stent, all that kind of stuff.
Would a calcium score be wise for somebody like that that's already kind of up against it?
It becomes very difficult because the bypass distorts the anatomy, and there's also metal in the chest. You can do it, but you have to have somebody reading the scan who really knows what they're doing.
Yeah.
Because there's so many changes introduced in the heart anatomy after a bypass.
Yeah, chances of that happening is probably slim to none right now, just because of the doctors that he has been seeing. I don't know where he's like the last checkup and whatnot, but I mean he's been fine. You know, he's healthy. He's still running all around the place, but it's just something that's like always heavy on my mind because I'm like I keep hearing that this is not the right path that we should be following, but we'll see. I'm hoping I can send this to him and help him like wake up.
Has he shown interest in like making changes to his nutrition before?
I can tell you the week after he got off that hospital bed, he was all for it.
Okay.
And then, but now it's been a couple years removed from that, and he's been fine. No scares or anything like that. And so now he's like, maybe I'm okay now.
Right.
Maybe it is working.
Right.
So, I don't know. Hopefully, like I said, I can change his mind. Just in general, like just my parents, both of them, they're like I guess baby boomers. I don't know if that's correct, but they're they're really they stick to their ways.
My dad, who's in the room right now, he's pointed out to me before. I've asked him before. We've had a few family members who've gotten sick and even lost some, and I kind of asked him why would somebody who kind of knows that they're not healthy, why would they just continue down that path? And he just said, because it's easier. And that's true, right? Like, it's pretty simple. It's easier and it doesn't sound like it'd be easier because it doesn't make any sense really, like to be in pain and to have suffering. But it is like change is very scary for people. And they think, man, like you're like, they just can't figure out what their life would look like. Like, how do I go to the movies? How do I, enjoy every Friday night when that favorite TV show comes on? What about Thanksgiving? And what about Christmas? Like, these are my favorite things every year, and I got to eat the stuffing.
Yeah, I mean,
you can't tell me I can't eat the stuffing.
Yeah, I just got a question right now. It's like, so what do we eat? Just meat and carbs from vegetables? Like, is that it?
So the crucial step is no grains. So grains cause heart disease. You wouldn't know that, though, by looking at something really stupid like cholesterol testing. You want to look at what's called advanced lipoprotein testing, like NMR. There are a variety of techniques. I've done mostly NMR. There's a San Francisco company that does a different sort. They do an electrophoretic method. But NMR is easy, inexpensive, and it gives you a ton of information. But you'll see right away that heart disease is a dietary disease, amplified by various nutritional deficiencies. It becomes very obvious once you get beyond cholesterol testing.
Was there heart attacks before grains were around?
There were, but they were uncommon. We don't know how far back that goes because there's no fossil record, there's no bony record of heart disease. We do know, though, that with consumption of grains, there was an explosion in aortic disease, though. That we do know. But there's no preservation of coronary arteries. I should mention to you what happened to the first humans who ate traditional strains of grains. Because people often say, well, this wheat belly guy says modern wheat's the problem. Let's go back to heirloom or traditional. What happened to those first humans who consumed wild einkorn wheat? There was an explosion in tooth decay. Very interesting. Before humans ate grains, only 1% to 3% of all teeth recovered showed decay or tooth loss or abscess or misalignment. When grains were added, whether it was wheat or millet in sub-Saharan Africa or maize in Central America or rice in Southeast Asia, there was an explosion in tooth decay. 16 to 49% of all teeth showed decay, abscess, or misalignment. There was a doubling of knee arthritis, and there was appearance of nutritional deficiencies, because you can see that in the bony evidence, like something called cribra orbitalis, which is evidence for iron deficiency. So in other words, even consumption of ancient grains caused an explosion of health problems. So what we did was we traded near-term survival, because it is a source of carbohydrate calories. We traded near-term survival for long-term health. But now it's become obvious because our own U.S. dietary guidelines for Americans told us to pack our diets full of grains. Breakfast, lunch, dinner, and every snack should contain a grain, they say. And when you do that, and agribusiness changed grains, now it became patently obvious that grains are an enormous problem. And so if you're going to start on diet, that's like the basic starting place. And then secondarily, limit your net carb exposure, because like we talked about, so many diabetics and pre-diabetics in the world now with insulin resistance. And then never limit fat. Eat more fat. Eat. Fats are very satiating, right?
Right.
If you have a ribeye steak with fat in it, it's very filling.
Delicious.
Yeah, and it's delicious. Have eggs. Eat the stinking yolk, for God's sake. Have butter. If you're going to have dairy, dairy's a whole conversation of its own. But if you have dairy, the most benign component of dairy is the fat. You got to be nuts to be drinking skim or low-fat milk or low-fat dairy. Get the full fat. Cream, half and half. Butter, right? Because the fat's the healthiest component. The problem with dairy, it's the other things. It's casein, beta-A1. It's lactose, it's other issues. After that, lots of vegetables. The prebiotic fibers are very important. Now, I don't think we have time to go in this, but there's something to be aware of. If your readers or your dad, Andrew, adds prebiotic fibers to his regimen, whether it's legumes or a raw white potato in his smoothie or inulin powder is another form, and he gets sick from them. He gets diarrhea, bloating, and abdominal discomfort. Then you know he has small intestinal bacterial overgrowth, or SIBO, which is incredibly common. I would estimate that SIBO is on a par with type 2 diabetes and prediabetes in the U.S. The CDC now estimates that over 100 million Americans have prediabetes or type 2 diabetes, a huge number. I think the number of people with SIBO is at least that big, because I'm seeing it everywhere. And I was guilty of underestimating how common SIBO is.
What's SIBO?
So it's small intestinal bacterial overgrowth, meaning bacteria is supposed to be largely confined to the colon, the large bowel. But in this instance, they have ascended through the ileum, jejunum, duodenum, and into the stomach. So you essentially have 30 feet of infection with unhealthy organisms in the Enterobacteriaceae family.
Can this could this potentially lead to cancer?
It can lead to colon cancer, diverticular disease. It's often diagnosed as fibromyalgia. Fibromyalgia is essentially SIBO, and SIBO is essentially fibromyalgia. The gastroenterologists are thinking of doing away with the irritable bowel syndrome designation and calling it by its real name, SIBO. Restless leg syndrome is SIBO. People with type 2 diabetes, type 1 diabetes as well, and autoimmune diseases, a large number of them have SIBO. So it's add all those numbers up. We're talking about at least 60 million Americans with SIBO, probably north of 100 million.
What about things that affect the brain? Are they connected to this?
Yes, now it's becoming clear. Parkinsonism, Lou Gehrig's disease, a lot of the central nervous system disorders, dementia, Alzheimer's, are at least in part dysbiosis
your
or
stomach
SIBO.
is like your second brain, or some people even call it your first brain.
So it's becoming clear, but it's also reflecting the absolute power of the bowel flora over human health. Now, I won't pretend that we have all the answers, because that science is unfolding very rapidly. But like the oxytocin boosting effect of our yogurt is an extremely powerful, potent effect. But we need more answers like that. I think what we'll be saying in just a few years is, if you have Parkinsonism, this is what you do. You populate with this group of species. We know, for instance, that kids who have intractable seizures and thereby benefit from ketogenic diets, they'll have those problems. The responsible agent for that relief from seizures is the growth in the Akkermansia bacterial species and some others. In other words, it's going to be possible to treat your seizures with a probiotic and have it to be more effective than seizure drugs. And we're going to see more things like that. So the same thing is likely to happen with Parkinsonism. and Lou Gehrig's disease, and a lot of those other conditions too. Dementia. There is one trial now in dementia where a high-potency multi-species probiotic actually improved cognition and reversed dementia partially.
What do we do with our kids? Like what about, how do we make them a peanut butter and jelly sandwich and stuff like that? Like, what do you do with children? Do you follow the same rules?
It depends on the age. If you can start them young, you'll be shocked at the health of your children. They won't get sick. They won't be getting the flu. I mean, all this really cool stuff happens. What if you have a 7, 8-year-old or even worse, 14-year-old who won't change? I think all you can do is educate your kids, and they'll still have pizza at the pizza party, and they'll still have cake at the birthday party.
I cook for them.
Perfect.
There you go. Problem solved. I cook for them every morning, and they have bacon and eggs and butter and cheese and I try to mix it up a little bit so they're not I try not to be too crazy about it. So every once in a while they may get like a piece of toast or something like that. They may get some milk with their food or whatever, or even some like orange juice. But I try to the best I can to have it be at least 90% healthy. And then at dinner time, my wife usually cooks, and that's always kind of following some of the same rules as well.
That's a great way to do it. Now, they'll go to college or move away and start doing bad things for a while. But
every time we go out to eat, my son, he orders a Coke, and he does kind of his own thing, and I, give him an evil look. And I always tell him, I say, you kind of do your own thing. You're old enough. I trust you. You're responsible enough. But when a waiter comes back and wants to pour more, please tell him, please tell him you don't want any more, because they'll just keep, refilling it.
Right.
But what people don't realize about these things is, that's not like an innocent thing. That's not a small thing. It's a big thing, because you're consuming, if they keep refilling it and you're thirsty and you have an additional 75 grams of sugar, that is not an innocent thing that should go unnoticed. And if you're knowledgeable enough and you know these things, well, shit, you gotta protect your children, right? To me, it's not any different than watching your kid cross the street when the "Don't Walk" sign is up, and you don't stop them. Like, I got to stop him. I'm going to allow him to have some wiggle room, to be his own person, to be his own man, and those kinds of things, because it's important that he learns to make his own decisions. And sometimes he makes his own decisions and he goes, oh, shit, maybe my dad was right, or maybe my mom was right. It's important to fall and stumble on your own a little bit. But at the same time, I'm like, I'm not going to watch this happen in front of me.
I think that's the best way to do it. And you're setting the example of health.
Right.
And even if he veers off for a while in college or whatever, they'll come back and say, hey, mom and dad did this way. I should do that too.
Right. Yeah, it's a constant battle. But my kids, what I've learned is they actually don't care. So like, the kids will ask for ice cream. I'll say, no ice cream tonight. And they'll go, okay. They really don't care that much. I mean, but it's because we've reinforced this over a period of time. Harder thing is to try to get them away from their phones sometimes, and they're like, "Well, you're on your phone," and I'm like, at least with the food, I can, they're not going to be able to point to too many times where they saw me like down a giant bowl of ice cream or something.
Yeah.
I should mention that, if you guys and families are doing these kinds of things, so I learned this long ago, that people would do the lifestyle and have magnificent results, lose 70 pounds, become non-diabetic, blah, blah, blah. And they'd come back after Thanksgiving, and they went back to all the old habits. They come back 14 pounds heavier. Their blood work's a disaster, small LDLs through the roof. They're diabetic again. So what I did was it became clear that, while I'd like to say just eat good, real food and end it at that, it was more practical to say, here's how you recreate healthy gravy. Here's how to make healthy stuffing. Here's how to make a healthy pizza. Here's how to make ice cream so that it's so healthy, you eat all you want without worrying about portion size. So one of the things I also try to help people do is find ways to convert unhealthy foods and recreate them in
options.
In healthy ways. And you can, by the way.
Yeah, empower them, give them the right tools to succeed.
But you will have to make these foods for the most part.
Gotcha. We had a in-studio question. I don't know if
from one of our fans?
Yeah, I think so. I think
got my mom and dad in studio here today.
Yeah, so after she asked if you can reiterate so people can hear it.
Yep, gotcha.
But go ahead.
Oh, okay. Well, I used to work for a cardiologist for about 10, 12 years, and I used to wonder, how come you have very tall, thin people, little short, heavy people? It didn't matter, male, female, they're all different sizes that had some really terrible heart disease. And one time I was talking to the doctor, I asked him, and he was very good at explaining things, but and very good about nutrition, and the best he could be. I mean, that's the way they gave you a lot of pills. But one thing he taught me was that there's two kinds of problems that can happen, and he called it plumbing and electrical. And plumbing was more your like Andrew's dad or Mike or me probably. You just keep filling up all the arteries with all kinds of plaque and everything. And the electrical can oftentimes be like a sudden death, as something went awry in the heart, and it wasn't picked up on one of the conventional tests. Now, I don't know if they've improved on that, or they find that out, or the diet helps both aspects, whether it is plumbing or electrical, or whether it's, everything is just from what you eat.
Did you want to read?
Yeah. So basically, my mom is asking, whether, so sometimes people die of a heart attack at 20 years old. And maybe it's not nutrition. Like, we've heard these stories time and time again. They're like, I don't get it. He was a really active kid. He was a swimmer. He did all these things, and bam, something happened, and he went. And so my mom is kind of asking the question of, sometimes it's like an electrical thing. As she pointed out, she used to work for a cardiologist, and that's the way this cardiologist kind of put it. Sometimes an electrical problem, which would be the case of this 20-year-old kid passing, or sometimes it's just like a plumbing problem, which is something that built up over the course of you stuffing that toilet paper down the drain for way too long, and 20, 30 years later, then you have heart disease.
So this lifestyle can affect both those things, the plumbing as well as the electrical system. So the plumbing would be coronary disease. Now, your 20-year-old who dies probably did not have either of those things. That's probably a hypertrophic cardiomyopathy or some other cause that's congenital. So that's getting kind of off a whole different area. But when I say plumbing, it's pretty much coronary disease, like Andrew's talking about with his dad. The electrical problems, that is the variety of heart rhythm disorders and instability so a very common cause is magnesium deficiency. So you probably remember, people would be hospitalized with torsade and ventricular tachycardia. Those are not entirely, but largely magnesium deficiencies, and potassium also. So there's an effect. Omega-3 fatty acids that we supplement are rhythm stabilizing also. Dysbiosis can contribute to electrical problems. Now, one of the problems, though, with some wiring problems like atrial fibrillation is that it's the end result of decades of abuse of your heart's conduction system. High blood sugars, vitamin D deficiency, lack of omega-3 fatty acids, etc. So when it shows itself as rapid bursts of heart rate, of chaotic heart rate, atrial fibrillation, you've lost control of the nutritional part of it. So that's why I tell people, if you're going to do this, do it yesterday. Start yesterday, because you don't want irreversible problems. If you had autoimmune pancreatitis or autoimmune hepatitis or Hashimoto's thyroiditis or atrial fibrillation, they become largely irreversible at that point. So the key is to do like what Andrew's doing. He recognizes the risk in him because his dad has it. So Andrew's goal in life, among his goals in life, is to never allow himself to have coronary disease, but not by doing something silly, but like taking Lipitor and aspirin.
And you'd see some people that had great tachycardia, and they'd be, all I did was walk across the room, and now I can't breathe, and then they'd be all calm and like go to sleep. You just sleep. And a lot of times, though, I did notice, just myself, if nobody told me, or I don't even know if it's true, that a lot of people did have type 2 diabetes that had the heart problems.
My mom's kind of, I guess, saying that a lot of the people that had some of these problems had type 2 diabetes as well.
Yeah, type 2 diabetes and coronary disease, that is potential for heart attacks, bypass, are essentially, they overlap incredibly. So it's a little uncommon to have coronary disease without diabetes. So as you see, insulin resistance that leads to diabetes is rampant. It's what's driving the growth of dementia. It drives cancer risk. drives heart disease risk, and of course diabetes. And so it's pretty bad. But was largely caused, or at least markedly worsened, by conventional dietary advice. The people we thought were doing us favors were doing nothing of the sort. They were causing the worldwide epidemic of obesity and type 2 diabetes and autoimmune diseases. So we just can't let these people get away with this anymore. And yet they're not going to undo this because so much of the dietary message is influenced by industry. So when the USDA guidelines come up for debate, they open it up to their credit. They open up the conversation to the public. But people like us have jobs. We have things to do. We have families to attend to. But the big companies will put their lobbyists and employees and sit there day after day lobbying the U.S. government to change the dietary guidelines in their favor. So you'll never hear messages like this from dietary guidelines because it's too heavily industry influenced. That's why podcasts like this are so important.
Mark's older brother, who unfortunately passed away, used to say that the pyramid should be flipped around the other way. That if you're going to delve in any of the seeds and grains, that they shouldn't be taking up the whole bottom part.
That's the food pyramid and stuff like that. We've had a lot of like misguided advice over the years. People have I run into a lot of people that kind of tell me that they have a hereditary history of heart disease in the family and stuff like that, or and maybe later in life they end up with kind of an irregular heartbeat, or I hear people use the term AFib, which I don't even really know what that means, but sometimes these things happen and the heart rate races, and then they're off to the hospital and trying to get, again, it's like in a panic, you don't know what to do, and you're kind of turning your life over to the doctor, and they are giving you cholesterol medication. They're doing all kinds of stuff, but really what you're saying is like, let's not, the problem, probably didn't happen from just a cholesterol issue, although it could be potentially from the little cholesterol, right? The LDL, right? It could potentially be from that, but it's probably from a series of things that have happened over a period of time, along with stress that happens during the day, poor dietary choices, poor sleep. It's these things have kind of manifested themselves into the current situation that you're in. And if you follow a lot of the advice that you're recommending, you can quickly turn a lot of these things around.
You can, but it remains key that you do this early enough in life before you develop things like AFib or other not so easy to reverse or influence problems.
Is there medication that can kind of help, or we're talking about cholesterol medication, but is there medication for the heart that can help somebody, like that they may actually need? Yeah,
there are. Though I'm a critic of big pharma and the practice of healthcare, there are drugs that actually do their job. But I will tell you the list of drugs that do their job without harmful effects is very small.
Yeah.
So beta blockers, for instance, are very, very commonly prescribed. Those are blockers of adrenaline, and they're prescribed in high blood pressure. They're prescribed in people with coronary risk because it reduces sudden cardiac death a little bit. It's also used in certain forms of heart rhythm disorders. It's used in what are called cardiomyopathies and heart failure, and they do help. The problem is they also help make you diabetic and cause you to gain weight and raise your triglycerides and increase your small LDL. So this is typical of healthcare. We give you a drug that does one thing and generates a whole range of other problems. But we have other drugs for those problems, don't we?
That's right.
Yeah.
And when it comes to blood pressure medication, a lot of them are things that dehydrate us, right?
Yeah, I laugh at that. It's sad, but I laugh at it. So we're told hydrate for health, right? It keeps your blood from coagulating, it keeps you alert, etc. Yet they give you diuretics for high blood pressure, like a thiazide, like chlorothalidone or hydrochlorothiazide, that causes you to be dehydrated, raises your triglycerides, provokes formation of small LDL, increases potential for type 2 diabetes by 30%, and is associated with occasional sudden cardiac death.
How is that even something that's prescribed? I mean, how is somebody getting away with giving you a diuretic? I mean, people are taking these on a daily basis, right?
Yeah, and because there are large clinical trials that show it's a cheap, easy way to reduce blood pressure.
Wow.
Yeah,
I mean, to me, that's mind-boggling. I mean, the amount of,
I think it's criminal.
yeah, it really is. I mean, the amount of negative effects it has on your body to just be dehydrated.
Right, makes no sense, right?
And it's so immediate
makes no
too.
sense.
Like Lipitor and these other things, like it might take a little while for them to do their damage, but be dehydrated for 2 days and things get miserable really quick.
It's the logic of medicine. Patch one hole, fix the 3 new holes you made. That's how medicine works.
How have you stumbled upon all this knowledge? Has it been through studies or people you've run into over the years? Kind of how have you, because you had to educate yourself on top of you working all these hours as a doctor?
Well, it was a lot of the same reasons I wrote the Undoctored book, and that is what I saw is people taking the reins of personal health and having absolutely jaw-dropping, spectacular results. For someone to say to their doctor, hey, I don't want to be a diabetic anymore, he says, shut up, take your insulin, take your biotic injections, and take your metformin. And make sure you cut your saturated fat and eat more healthy whole grains. He just gave you more diabetes. He gave you higher. But that same person does these basic things in health, and they come back off insulin, off biotic, off metformin, and slender and healthy. It showed me just how powerful people can be in their own personal health, but it won't come from the doctor. In fact, people succeeded despite the bungling of the doctor. And that's what I see playing out now. Now, I'm generalizing, of course. There are good doctors, too. There are functional medicine and integrative health docs that are doing the right thing, or at least trying to. I'm talking mostly about the mainstream doctors who see you in the hospital, who see you in the office to check your blood pressure, all those conventional things. These are the people who lost sight of what they're supposed to be doing.
You got another in-studio question. I think people are taking us up on the $100,000 in-studio ticket offer. It's pretty awesome. We've got to open up to more people.
Well, my question is, I've been looking up while we've been talking. I've been looking up life expectancy. Okay, and Japan is number 1 in life expectancy, and America, which is supposed to be the best health care and so on, we're 31st on the list. However, let's see. Austria and Spain are tied for 4th. Iceland and Italy are tied for 6th, and Sweden and France are tied for 9th, which puts us at 35th on the list, okay? So we're 35th, and you hear all the time about the American health system. You hear about the medical care here and how long they have to wait in Germany. Germany's ahead of us. How long they have to wait in Canada. Canada's ahead of us. Everybody's ahead of us in terms of life expectancy. Ours is like 79.3, and it's 84.7 in Japan, okay? Now, we claim to have one of the best healthcare systems. However, when I see Mark and I see Chris, and they're in discussions with doctors, we have doctors in the family. I've been on doctor's appointments with them. They've been to my doctor's appointments. And these doctors will sit and argue with them. Well, the American Medical Association, I've been in practice for 38 years, and the American Medical Association does not support what you're saying. The American Cancer Society does not support what you're saying. The American Heart Association does not support what you're saying. And you're not a doctor. How can you possibly have an opinion on this that carries any kind of weight? So citing that doctors are so stuck on their associations, they're so stuck on their college educations that are 30 and 40 years old because they're at the peak. They're the directors at the college. They're the director over the eye, ears, and nose and throat, or they're the director over the heart part of the college. Okay, so dependent on the American Heart Association articles and the fact that the stuff that they're saying isn't published, that they're just totally and completely closed to it.
Exactly right. You're appreciating just how broken the American healthcare system is, yet it costs more than any other country in the world. We pay more than everybody else. And by the way, the only 2 countries on earth that allow direct-to-consumer drug ads is the U.S. and New Zealand. both of whom have the highest healthcare costs in the world. So we have the most expensive healthcare system in the world that, by the way, ranks last in quality of care compared to the 13 or 14 other westernized countries. So I hear that from my colleagues. We have the best healthcare system. No, we don't. We have the worst healthcare system in the Western world. And as you point out, we're seeing now a downtrend in longevity because the national guidelines and other factors, glyphosate in our food, hormonal disruptors in plastics. And I mean, other parts of the world aren't quite as exposed as we are because we have a willy-nilly lack of legislation, for instance, on industrial compounds being disseminated. So there's a lot of problems here. You and I can't fix them all today, but I think listeners need to hear that. Take a few basic steps. Don't become victimized by the ignorance of your doctor, who, as you point out, his education is woefully out of date, and he's not concerned with your health. He's concerned with the bottom line and whether he can drum up more procedures for him. Or, I live in Milwaukee, where most of the doctors are now employees of healthcare systems. And they tell me that they're told this by the administrators: Doctor, more revenue you raise for the healthcare system, the larger your end of quarter bonus. So Dr. John Smith drums up more MRIs, neurology consultations, heart catheterizations, bypass operations, and other procedures because his bonus will be much bigger that way. So that's the system we're dealing with. The tragedy, of course, is if you want a message of health, you can no longer get it from most doctors. But that's why what we're doing here today is so critical, so that people hear these kinds of messages and don't fall for the nonsense that comes out of the doctor's office.
Thank you.
No one has to worry about us being 35th because our country is so unhealthy that we're making other countries unhealthy. So we won't be 35th for long. We'll be able to catch up because we're infiltrating all these other countries with McDonald's, Coke, and Pepsi. I know that these trillion-dollar companies will take care of us and move us back up the ladder as they kill more and more people off fast.
Get rid of the competition.
That's right. Take people out.
Yeah. No, I'm good, man. I mean, there's a couple of people asking about like lifting. One guy's actually asking about running, but what do we eat for performance? Like I know a lot of like lifters that we love to eat carbs and stuff to get the pump going and whatnot. Is there a happy medium where we can add some of these things that you're saying may not be the greatest for us, but will help us in the gym?
Yeah, or are there some carbs that you'd recommend?
Yeah, there you go.
I think you're seeing in the CrossFit community, to some degree, some of the weightlift community, some of the triathlon community are starting to understand that carb loading is very, very bad for you.
Mm-hmm.
It contributes to dysbiosis, insulin resistance, small LDL particles, dementia risk, etc. So the problem with that, and I have a professional tennis daughter who we had to do this with her. Transitioning took 6+ weeks. Mm-hmm. So transitioning from a high carb loading lifestyle to an almost no carb diet, not ketogenic though, because ketogenic has its own issues, right? We talked about that, but takes about 6 weeks, and then you can perform at a very high level without the carbs. An occasional type, and it's probably genetically determined, may need modest increase either in protein or modest source of carbs during prolonged endurance, like a 100-mile bike or a marathon run. But most people don't need any carbs. Now, I know the weightlifters will say, but if you add carbs, you get an insulin response and it helps build muscle. But you're sacrificing health in the process. You can't consume a lot of carbs to build muscle and not provoke formation of small LDL particles, insulin resistance, dysbiosis, etc. So I don't think it's a good idea to sacrifice a big part of your health for the sake of more rapid muscle growth. But let me throw this one plug in. Now, boost oxytocin. That works. That, I go to the gym. I do a variety of things, but I go to the gym to use the machines, etc. Maybe 15 minutes, 20 minutes once a week, twice a week. In other words, I don't do that much. I gained 12 pounds in muscle from that yogurt.
Wow.
So I'd rather do that.
What the hell's in that?
I got to get this yogurt. How much trend do you put in the yogurt?
Yeah.
No, that's all I got, Mark.
A lot of times when it comes to like bodybuilding, powerlifting, I think the trend is to, feed your body nutrition throughout the day. As we talked about earlier, you kind of mentioned not a great idea to feed yourself 6 times a day. But it's been something that's been done by bodybuilders for a long period of time. And so when they're feeding themselves, X amount of times per day, they have carbs, fat, and protein, carbs, fat, and protein, carbs, fat, and protein. And they don't really cut out any one thing. If bodybuilders to do a bodybuilding show, they may cut back on the carbohydrates and they may cut back on the dietary fat quite a bit and really just kind of run off of protein as they're going. But we all kind of understand that's not the healthiest practice. Your suggestion is about 15 grams of carbohydrates per meal or so, and if somebody had 3 or 4 meals in a day, it would be 45 to 60 grams of carbohydrates. I think a lot of the people that are active, that are moving around, and to kind of answer that question a little bit more specifically with like a number, I think a lot of people that are active, that have muscle, that are healthy, that are young, can probably have 150 to 200 grams of carbs a day, and not sacrifice their health. Because I think in a lot of cases you're going to be utilizing a lot of those carbohydrates. You're going to be kind of burning up a lot of those sugars. And in my own experience, I did very well off of about 100 to 150 grams of carbs, which for somebody my size is really just, it's not that much. And I think most of the bodybuilders and most of the even power lifters, I think they would say, back when they were eating more and more carbohydrates, and that was kind of the thing, a lot of them would say they would be just as big and just as strong with less. And so I think that the amount of yes, carbohydrates are going to help, and it's going to help keep your muscles feel full. Carbohydrate will help hydrate the muscle. There's definitely something to that where you have this kind of, for lack of a better term, like intracellular hydration that makes you feel awesome when you're in the gym. It makes you feel strong. But how much of that do you really need? I think it's probably half of what you might think. Some of these guys are having 500 grams of carbohydrates every day, 400 or 500 grams of carbohydrates every day.
He's about to have a heart attack.
Yeah, poof. Well, for each guy might be a little different. It may be necessary, but I do agree with the statement that it could be at the risk of your own health, having excessive amounts of muscle mass. Being excessively lean. Like neither one of those things is probably that great for your body, really. Like the body's
Right.
body's going to be kind of resistant to you being too far out of reach of what you're normally supposed to be.
Yeah, and then we hear a lot of people like, I lift, it's okay, I can eat X amount of carbs or calories or whatever. Can we, let's say, have 100 grams of carbs and then chase that down in the gym? Will we break even if we exert that amount of energy to kind of break all those down and burn them up?
No, because the response is unfolded already. You can limit the duration of it, but I tell you, one of my kind of litmus tests for all this is having done thousands and thousands and thousands of lipoprotein analyses. And the lesson you learn over time with that is just how easy it is to increase your cardiovascular risk. It is as easy as one slice of pizza. It's as easy as one whole apple. And you'll have oodles of small LDL. So if I had, let's say, some carb on Monday that exceeded 15 grams net, let's say it was 50 grams, I'll have small LDL for a week. As opposed to large LDL provoked by fat consumption that lasts for about 24 hours. So, because I came from the world of heart disease and you see what happens to people with that, and it is very common after all. Heart disease, #1 killer, right? So I still think about that, how easy it was for people to have small LDL particles and thereby cardiovascular risk.
Are vegetable oils a real problem? I'm kind of hearing more and more information come out about that. The polyunsaturated fats, people are kind of making a big thing about that. Do you think it's really a huge issue?
I think it's an issue. I don't think it's the biggest issue. It's not clear, if you look at the science, whether the excessive consumption of polyunsaturates like linoleic acid is really a surrogate measure for lack of omega-3s.
Right.
That may be part of the issue. But there probably is an issue with overconsumption, which is what happens when people eat fast food diets and do crazy things like eat margarine. So I think it is, but it's not the biggest issue, but it is an issue, I think.
Well, and even when you go out to eat, you're eating a lot more calories than you would if you ate at home, because they're they're trying to make everything delicious for you so you come back.
Mm-hmm.
So they're cooking everything in as much oil as possible. Chris, did you have a question?
The only question.
You just hop over here to the
You're good.
microphone.
Yeah, I do have a question because we talked a little bit about a carnivore diet when we were eating breakfast this morning at the Black Bear Diner, eating a steak. My question actually is really important for the carnivore diet and anybody doing it. We have a big problem with glyphosate that we hear in wheat and wheat products, right? And different grains, and we get we eat these animals that sometimes eat these grains. I eat a lot of grain-fed beef because I like it. It tastes better. Is that causing a problem? Have we seen the glyphosate go from the animal into the human being, and has that affected the human being?
Good question. I don't know. I'm not sure that's been looked at, but that would be an important question to look into if there's transfer of glyphosate from the meats and fats you eat into you. I don't know.
Okay.
But good question.
We'll have
But
to
it
look
is
into
clear. It is clear that GMOs are a big problem. The industry won't admit this, focusing more on whether the genetic changes themselves are deleterious, and they ignore the whole fact that a lot of the GMOs are linked to various herbicides, pesticides. So I think it's a problem, but I don't know that
Yeah,
specifically.
it seems to be the only drawback. The only thing that I can look at the diet and say, like, okay, that's something I really need to look into and figure out. The rest of it seems to be working really well for me and be pretty safe. I'm just worried about that. That's the only thing.
What would be your main concern with a carnivore diet? Would it be the same thing as the ketogenic diet? Like if you did it for a long period of time, maybe you're not feeding the gut flora?
Yeah, exactly. So whether it's Atkins or ketogenic diet or carnivorous diet, the lack of prebiotic fibers is a real serious issue. It won't lead to problems in weeks, but it will in months to years.
Right.
And that can show up as diverticular disease or colon cancer or heart disease or other forms. So I think it's a real issue. So attention to prebiotic fibers is really an essential thing. And I think in this day and age where we're paying a lot more attention to the microbiome, it's becoming clear just how massively disrupted you can be by doing those kinds of things for an extended period.
Where can people find you? Where can people buy your books and find out more information about you?
The books are everywhere, all bookstores, but the
Amazon,
most
everything like that.
Amazon, all that. The most active conversations are the Wheat Belly blog, the Wheat Belly Facebook page, the Wheat Belly 10-Day Grain Detox private Facebook page that you can get on. There's an undoctored blog, undoctored Facebook page. So there's Google
Great.
it and you'll find it.
Awesome. We'll attach that to this podcast. Appreciate you coming out here. This has been amazing. This has been awesome. The information you shared today is going to make a big difference. We really appreciate it. Strength is never a weakness. Weakness is never a strength. Catch you guys later.